Hello, I'm Dr. Amiti Agarwal. I'm the Medical Director of Sunshine Fertility and IVF Center, Mumbai. We are running 3 centers in Mumbai, in Bhandup West, Vikhroli East and Santa Cruz West. So I'm going to now highlight on certain very important aspects and subjects of infertility to guide you and to make you aware of how we are supposed to tackle the infertility issues. So the first topic that I'll be talking about is what is infertility and when should you try to consult a doctor, or when should you get a red flag in your mind that you are supposed to take some kind of treatment, or maybe you may be suffering from this infertility. So basically, what is infertility? As per the national and international guidelines, any couple who has been trying naturally for a year and is unable to get pregnant becomes a candidate for infertility, and they should seek medical advice. Also, if the couple is more than 35 years of age, then if they are trying naturally for about 6 months and still not able to conceive, then they should immediately seek medical help. So for a man and woman, what are the signs? How do you get an idea, or what are the different markers that you may be suffering from some infertility related issues? So for a woman, most important is that her general health must be okay. You should not feel that suddenly there is a weight gain, or there is growth of hair on the face, or hair fall, and the periods becoming irregular. These are all symptoms of PCOS or PCOD, which is called polycystic ovarian disease or polycystic ovarian syndrome. This is one of the important reasons for infertility in women today. In India, there are almost out of 10, around 3 women in India are suffering from PCOS. The most important reason why the woman experiences infertility is her irregular cycles. The period is not regular, the growth of the egg is not uniform, there is improper growth of the egg, because of which the ovulation doesn't happen, and because of anovulation the patient is unable to conceive. So that is one important thing. Second thing is, if you experience too much of pain during a menstrual cycle, some women complain of severe pain few days before and few days after the period also. And also, one of the other symptoms is that while having sexual intercourse, you may experience very deep pelvic pain, or while passing motion, you may feel deep pain in the region where you're passing motion from. So these are all symptoms of endometriosis, which you may not know. Sometimes endometriosis is not seen on ultrasound, so you may require detailed testing, you may require maybe some patients require MRI, some may even require a laparoscopy to diagnose endometriosis. Again, endometriosis, if not diagnosed on time, it may proceed to forming chocolate cyst or endometriotic cyst, which again are a big hurdle in getting pregnant. So one is PCOD, second is endometriosis. You have to be very cautious, you have to be very aware of these symptoms, and in case you are feeling any of these symptoms, you must consult your doctor. The third thing could be any history of tuberculosis in childhood, or any infection, or any history of severe vaginal infections in adulthood, where there is, you may be suffering from bacterial vaginosis, or you may be suffering from some trichomonas infection, or any vaginal infection which may lead to ascending infection, and it may lead to blocked fallopian tubes. So that is one thing which again is one important cause of infertility. If there is any blockage in the fallopian tube, it could lead to infertility. Third could be, suppose you are having intermittent spotting during the entire period. So suppose you have got your period, and then again after 10 days you experience some kind of spotting, again after 2-3 days you feel spotting is there. So that could be a marker of having some kind of a endocervical polyp, or you may be having some kind of a fibroid, or all these things. So even if these kind of symptoms are experienced by the patient, it's very important that you should consult a doctor. In men also, most importantly is erectile dysfunction, whether you are actually able to keep proper sexual intercourse. That is extremely important. The man can notice if there is any reduction in the amount of the seminal fluid which is secreted after keeping sexual intercourse, whether he is able to have proper relationship, whether he is able to produce adequate amount of semen, whether he feels a very different change in color or smell of the semen, even that could be a marker of some kind of infection. So all these are small symptoms or signs which as a layman you can understand, pick up and go to a doctor and seek medical advice. So for any further information or any further help regarding understanding of these symptoms or seeking medical care, you can follow us, subscribe our channel, and you can call on the number below and you can book an appointment with us. Thank you very much.